Okay, let's continue by describing these directional terms in a little bit more detail. So, as I mentioned, the term anterior or ventral describes the front or towards the front of the body. And so the anterior surface of the body refers to the forward facing or front surface of the body. But we can also use the word anterior to describe structures, so internal structures. So we can say that the heart is anterior to the vertebral column. That is, the heart is positioned in the body closer to the anterior or front surface here than your spinal column is. So anterior can be used to describe the front or towards the front of the body. On the opposite end, posterior describes the back surface or the direction towards the back of the body. And we can use the same two structures, but in the reverse. We can say the vertebral column. So the vertebral column, again, referring to the bones that surround the spinal cord. The vertebral column is posterior to the heart because the vertebral column is closer to the back surface or the posterior surface than the heart. So again, the heart is anterior or closer towards the front to the vertebral column, and the vertebral column is posterior to the heart. Superior describes the position above or higher than another part of the body, or towards the head, if you will. So I gave a couple examples before, but another example is the heart, located within the chest cavity or the thoracic cavity, is superior to the diaphragm. So the heart is located above the diaphragm. The diaphragm is at the bottom of the thoracic cavity, and the heart is within the thoracic cavity, or superior to the diaphragm. Inferior describes a position below or lower than another part of the body, or you could also say away from the head. And the example, the knees are inferior to the abdominal region, right? Because the knees are below the abdominal region. Or you could say the hip is inferior to the collarbone in anatomical position. So we can see our reference point here is anatomical position. This individual is standing forward with palms facing forward. So superior referring to higher of another part of the body, inferior being lower. Now, other words that you can use are cranial or caudal. They're typically used interchangeably, but they can be helpful when an individual is, for example, lying down on their side. And so if someone's lying down on their side, the word cranial means towards the head, and the word caudal means towards the tail. So now if someone's lying down, we could still think about if they were in anatomical position, and the heart would still technically be above the diaphragm or superior to the diaphragm, for example. But if someone is lying down on their side, sometimes it can also be said that the diaphragm is more caudal than the heart. So the diaphragm is more caudal, meaning towards the tail, than the heart. So these words can be used interchangeably, though. Okay, now let's talk more about lateral versus medial. So lateral describes the side or the direction towards the sides of the body. And we've already used this example that the thumb is lateral to the fingers. Because remember that our palms face forward in proper anatomical position. So the thumb is more lateral or more towards the side than the fingers. The fingers are closer to the middle. And medial describes the middle or the direction towards the middle of the body. And therefore, we can use various different examples to describe something that's medial. For example, the sternum or breastbone. The sternum is in the center of the chest region here. The sternum is medial to the left lung. The lungs are on either side of the sternum, kind of within, though, and behind in the chest thoracic cavity. You could also say that the heart is intermediate to the lungs, because the heart sits in your thoracic cavity and it is central to the location of the two lungs on either side of the heart. So you could say that the heart is intermediate to both lungs. So medial is just describing the middle or the direction towards the middle of the body. Now we have proximal versus distal. Proximal means closer to its origin or point of attachment. So the example here is that the knee is proximal to the left ankle. So proximal and distal often refer to appendages. So referring to the limbs, for example, because proximal just means closer to the point of attachment. So you can think closer to the attachment of the arm to the trunk, or the attachment of the leg to the trunk. So the left knee is therefore more proximal or proximal to the ankle. Distal means further away. So you could say the ankle is distal to the knee, but the knee is proximal to the ankle because the knee is closer to the trunk. Now, another example, your wrist is distal to your elbow. But if we were to talk about this region between your wrist and your elbow, now we're discussing, between two different locations on an appendage. We could say that that particular thing is intermediate. So we can kind of use that intermediate term again here. And we could say that if a wound is located here on the forearm, you might say that it's kind of in the middle between the elbow and the wrist. You could say that this wound is intermediate to the wrist and elbow. So in between two structures. So another example of using proximal and distal that's used in healthcare, these terms can also be applied to any open organ systems. An example of an open organ system would be the alimentary canal of the digestive system. So the digestive tract begins at the mouth and ends at the anus. And it is the alimentary canal is one continuous canal that goes from mouth down the esophagus, the stomach, intestines, colon, rectum, and anus. And so that's one continuous pathway. And therefore, we could use or explain closer to the mouth is explained as being proximal. So essentially closer to the external environment or the external of the body, if you will. And further from the mouth, closer to the anus, is considered distal. Using that premise, we could say that the mouth is proximal. And if we talk about the location of the esophagus, well, we could say that the esophagus is distal to the mouth because the esophagus is farther away from the mouth. Or we could say the stomach is distal to the esophagus. This also can apply to the respiratory system, for example, because it's open through the mouth and nose to the external environment, and the lungs are more distal. They're the deepest part of the respiratory tract. So these terms can be used for open organ systems as well that are open to the environment. Now, superficial and deep, a prime example of this is if we think about the skin or the internal organs. So superficial just means near the surface of the body. So the epidermis, epi meaning above, the epidermis is superficial to the dermis. The dermis is the middle layer of the skin. And the hypodermis would be considered deep to the dermis. The hypodermis is below the dermis, so the deeper layer of the skin. Hypo means below. So deep means away from the surface of the body. And an example of this is skeletal muscle is deep to the skin, right? Our skin is the outer covering on the body surface, and skeletal muscle is below that. So skeletal muscle is deep to the skin. For things like surfaces, like describing the surface of the body, we don't use above, like inferior, superior, because the surface stretches over the entirety of the body. So instead we use superficial versus deep. So again, the skeletal muscle is deep to the skin, and the skin is superficial to skeletal muscle. We talked a little bit about supine versus prone, but supine refers to the horizontal position with the body facing up. So again, this allows for access to anterior structures, such as the heart during heart surgery, perhaps during intestinal surgeries, things like that. These are more anterior structures of the ventral cavity, and therefore you would access them from the anterior surface of the body. So a patient for these types of surgeries would be lying supine, so the horizontal position with the body facing upward. Prone describes the horizontal position with the body facing down. Therefore, a patient may be lying prone during spinal surgery when we want to access the dorsal or posterior cavity of the body. Now, the feet hold a bit of a unique position relative to the other structures of the body. So they can be described or divided into two main parts. Two main surfaces. We have the plantar surface, referring to the bottom surface of the foot. So example here where plantar warts are located. Think like planting your foot on the ground. The surface that touches the ground is the plantar surface. And the dorsal surface, or the dorsum of the foot, is the part that is directly superior. So the top surface of the foot. Now think about if you flex the foot, if you have your heel on the ground and you point your toes to the sky, this is dorsiflexion. And the top surface actually points kind of backward, right? If you keep your heel on the ground and you flex your toes, now the dorsal surface of your foot is kind of pointing back, and dorsal means, as we know, posterior. So it makes a little bit of sense too. And when the downward direction of the foot are pointing your toes downward is plantar flexion. Okay, so let's take a moment to do some directional practice based on what we've just talked about. So please go ahead and pause the video here and complete the following. So fill in the blanks indicating the directional term that would be relevant here. The wrist is blank to the elbow. So think about what the reference point is and what the term would be. And then below, compare the two terms. So provide the position of the wrist relative to the shoulder, or the position of the knee relative to the abdomen. So take a moment, pause the video, do some practice, and then I will take them up. Okay, so hopefully you paused the video there. Now let's take these up together. So the wrist is, if you said distal, you are correct. I'll write this one. I might see if I can type them in actually, because that will be a little bit quicker. Let's see. Okay, I should be able to type here. So the wrist is distal to the elbow. Now, the skin, as we saw, we have to think about what directional terms we want to use here. Do we want to be talking about, above or below, like superior or inferior? Or do we want to talk about more surface level versus deep? So the skin is superficial to skeletal muscle because it is closer to the outer surface of the body. The heart is blank to the lungs. Because there's a plural here, we're talking about both lungs. If you said intermediate, you are correct. So the heart is intermediate to the lungs because it sits in the center of the chest, just slightly off to the left, but the lungs are kind of on either side of the heart. So the heart is intermediate to the lungs. You could also say If we were just talking about one lung, such as the right lung, you could say that the heart is medial to the right lung or medial to the left lung, because the lungs are more lateral or closer to the sides of the body than the heart is. So the heart is medial to the left lung or medial to the right lung. Now, compare the position of the wrist relative to the shoulder. So we would say that the wrist is distal relative to the shoulder. The shoulder is more proximal. It's closer to the origin or to the torso, if you will, of the body. Position of the knee relative to the abdomen. Now, in this case, because we are comparing a region on an appendage to a part of the trunk, if you will, or to the abdomen, we would say that the knee is, you could say, inferior to the abdomen. So technically, in this case, superior, inferior works best if an individual is like lying down, for example. Some may say the knee is more caudal, but caudal typically refers to tail. So the more accurate term here would be that the knee is inferior relative to the abdomen because it is below. And then position of the eyes relative to the nose. So the eyes, you could say, are kind of on either side of the nose, right? So the nose kind of extends from the tip of the nose up to the actual skull of itself, right? Because the bone that makes up the nose of the skull. And so that kind of extends up to be between the eyes. So you could say that the nose is intermediate to the eyes. Okay.